Hi, my name is Khodor Diab. I'm a nursing student. I'm a practicing nursing student at Seneca. I'll be demonstrating how to do assessment today. So this is my ID. This is the room. Okay. Okay, I'll be wearing hand hygiene. I'll be wearing gloves, but I don't have gloves right now, so I'm gonna pretend this is the alcohol swab. I'll be cleaning the stethoscope from the buffergram because I'm gonna auscultate. So right now I'm gonna say, hi, my name is Khodor Diab. I'm a practicing nursing at Seneca. I'll be demonstrating on how to do assessment on you today. Is that okay with you?
Yes.
Okay, so I'll be closing for privacy, and I'll be asking, do you feel any discomfort? Any?
No.
Do you want to go to the washroom?
No.
Okay, ID. May I know your first name and last name?
William Overton.
And your age?
92 years old.
Okay. So right now I'm gonna do the general survey. I'm gonna look at the posture. Posture is symmetrical and midline. And there's no any involuntary movement or any. The patient looks he's wearing for the appropriate weather, and his speech is clear. He looks his appropriate age, and the skin color is appropriate with genetic background, and no any foul odor or any abnormal odor. So he looks a good hygiene. He can maintain eye contact. No any physical deformities or any distress. So then I'll right now see the worker breathing. It looks not in the patient looks not in distress and not using any involuntary any extra accessory muscle. It's even and regular. And right now I'm gonna ask him some questions for level of consciousness. So may I know your name?
William Overton.
And date of birth?
1933. May 18.
Okay. Where are you now?
In a hospital.
Okay, so the patient is alert and oriented. Time is 3. So right now I'm gonna inspect the face. So first, inspect the face for symmetry. The skin color is appropriate with the genetic background and the rest of the body. No lesions, no inflammation, no abnormality, no visible abnormalities noted, and any involuntary movement, no swelling, no redness, no lesions, no masses presence. Symmetrical skin color is skin color. So can you remove your eyeglasses? I'll be testing the facial nerve, number 7. I'm gonna ask the patient, can you raise your eyebrows? Okay, can you close your eyes tightly against my resistance? Okay. Can you smile without your teeth? Smile with your teeth. Frown. Smile. Okay, and puff up your cheeks against my resistance. Okay. So the patient is able to demonstrate them, and the cranial nerve 7 is intact. So right now I'm gonna move to the eyes. So eyes. Right now I'm gonna look at the eyebrows. The eyebrows are even distribution, intact and symmetrical, and the eyelashes are symmetrical and even distributed. They're intact, and I'm gonna look at the sclera. The sclera is white, and can you close your eyes and open them? No eyelid lag or ptosis. Right now I'm gonna check for the sclera. Okay, the sclera is pinkish red. Blood vessels of presence. No any discharge or any deformity. So yeah. So right now I'm gonna test the cranial nerve 3, the oculomotor. So first I'll be checking the pupil size. Okay, they're equal, and they're 3 millimeters and equal and round. Right now I'm gonna see the light reflex if the eyes are reflective to light. So I'm gonna do direct and consensual. First I'll direct. I'm gonna look at the same eye, and consensual I'm gonna look to the other eye. Right now I'm gonna do the other eye. Direct, consensual. So the eyes are reactive to light. So right now I'm gonna do accommodation. Can you look up the furthest point in the room? Okay, right now can you look at my finger? Close to your nose. Okay, so the patient is accommodated. Can the eyes from afar dilate, and they constrict and contract when I move my finger close to the patient. And so cranial nerve 3 is intact. Okay, right now I'm gonna move to the ears. The ears are, I'm gonna inspect the ears. The ears are symmetrical bilateral. The skin color is appropriate with the rest of the body, and no cerumen on both ears. No lesions or redness visible. Right now I'm gonna inspect the nose. The nose is midline. No lesions or inflammation or redness or mass, visible masses, or nasal flaring. And the nasal passage is good. And no crusting. Right now I'm gonna go with the mouth. The mouth is symmetrical and the lips are symmetrical and moist. No any visible like redness, inflammation or swelling. No dryness. And the lips or color are pink, normal. Right now I'm gonna test the cranial nerves 9 and 10, the glossopharyngeal and the vagus. I just need the patient to, can you say while opening your mouth? Okay, so the uvula and the soft palate slightly move when the patient says so cranial nerve 10 and 9 are intact. Right now I'm gonna test another nerve for the mouth. So cranial nerve 12, hypoglossal. Right now I'm gonna let the patient to stick their tongue out. Okay, can you move it side to side? Okay, can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, so the patient is able to say light, tight, dynamite and move their tongue with no limitation, and their tongue is midline. Right now it's cranial nerve 12 is intact. Right now I'm gonna move from mouth to the neck. So first I'll be inspecting the neck. The neck is symmetrical. The skin color is appropriate with the neck background and the rest of the body. No any visible thyroid enlargement. Trachea is midline. No lesions. No any masses visible or inflammation or swelling. Right now I'm gonna palpate. Palpation. The whole neck. Do you feel any pain or tenderness? Okay, no pain or tenderness noted for the patient, and there's no lumps or masses felt. No enlargement of the thyroid while palpating. Temperature is warm to touch. No lesion or mass or deformity is noted. So right now I'm gonna test the cranial nerve 11, the spinal accessory nerve. So I need you to rotate your neck, please, side to side, and then I'm gonna put against my resistance with my hand on your face. Okay, the other side. Okay, and can you shrug your shoulders against my resistance? Okay, so the patient is able to the test without any limitation, muscle limitation. And right now, cranial nerve 12 is intact. Yeah. So right now I'm gonna move from the neck to the upper extremity. I tested the nerve. Yeah. Right now I palpate it, but like I should have when I palpate it, should palpate the carotid arteries. Okay. The carotid artery is symmetrical bilateral, even 2+ regular by rhythm. Right now I'm gonna move to the upper extremities. So I'm gonna palpate. Palpate the first I'll inspect. The arms are symmetrical bilateral, and the arm here are appropriate with gender. There's no lesions or masses visible, or any muscle bulkiness, or any swelling or inflammation or redness, or yeah. So skin color is appropriate with the rest of the body. So right now I'm gonna palpate. Okay, so the hands are like the temperature is warm to touch. No any lumps. Do you feel any tenderness while I was palpating? No tenderness or no pain or tenderness noted. No any deformities. No any muscle deformities felt. Yeah, so right now I'm gonna test I'm gonna see the radial pulse. Both hands. Okay. Okay, so I'm not gonna do it for a whole 30 seconds. So right now the radial pulse is equal bilateral, and 2 plus, and equal regular by rhythm and even. So yeah, I'm gonna test. Can you grip my both hands like with separate? Okay. So the patient is able to grip my hands. Right now I'm gonna go to the lower extremities. First I inspect the legs. The legs are symmetrical, bilateral, and hair distribution and hair is appropriate with the gender. There's no any visible masses or redness or swelling or inflammation or edema noted. And right now I'm gonna palpate. Oh, skin color. I think skin color is appropriate with the genetic background. So right now I'm gonna palpate from up to down to the toes. Okay. Do you feel any pain or tenderness?
No.
No pain or tenderness noted. No any lumps or any masses felt. Temperature is warm to touch, and no any muscle deformities or baldness felt. So right now I'm gonna move with the thorax and the lungs. Yeah. So the thorax and lungs, I'm just gonna need you to move a bit. Okay, first I'll be inspecting the thorax cage. The thorax is symmetrical, bilateral, and no any signs of like any visible deformities, no any involuntary movements. The skin color is appropriate with genetic background, and no lesions or no lesions or redness or inflammation or swelling noted. But like I'll be doing this testing without clothes, with like just exposing the patient's area where am I assessing. But right now I'm gonna do it on top of the clothes because of the privacy of the patient, my patient right now. So right now I inspect it. So right now I'm gonna palpate. So I'm gonna palpate from here, the thorax cage. Okay, do you feel any pain or tenderness?
No.
No pain or tenderness felt. No any masses felt or lumps. The thorax cage is symmetrical bilateral, and the temperature is warm to touch. Right now I'm gonna check the thorax cage expansion. Okay, the thorax cage is even expansion, and expansion is symmetrical. Right now, I'm gonna auscultate for, okay, whenever you feel the stethoscope, just breathe in and breathe out. I'm gonna do it fast because I don't have time. I'm gonna do it to 18 points. $15, $60. So no any inconsistent rate. So no any wheezing or crackling heard, or no any abnormal sounds audible, and no yeah, and it's heard and even, and no labored no friction rubs. So I can say that. So right now I'm gonna inspect the respiratory rate from the posterior side. So the patient, I'm gonna count it till 30 seconds, but it's 60 per minute beats per minute. It's even and regular by rhythm. Okay. So right now I'm gonna go with the cardiovascular. So I'm gonna go to the apical pulse. So I'm gonna go for on the left, it's mid-clavicular to the fifth intercostal space here. So I'm gonna auscultate for a whole 30 seconds or a minute. So okay, so the heart rate is 60 beats per minute, a regular, even and regular birhythm. Yeah. So right now I'm gonna go with the abdomen. So I'm just gonna let the patient lay in their stomach. So I'm gonna just expose the draping to the part I'm assessing. Okay, can I? Okay. So first, I'm gonna inspect for symmetry. Okay, so the abdomen is symmetrical and flat. Umbilicus is midline. Skin color is appropriate with the genetic background, and pubic hair is appropriate with the gender. No any masses, no any lesions or any deformities are visible. Yeah. Right now I'm gonna go to a auscultation. I'm gonna auscultate from the right lower quadrant, upper right quadrant, and left upper quadrant, and left lower quadrant. Okay. So I'll be hearing here no medium pitch vowel sounds and 5 to 15 seconds. No, like mild googling of the sound, your vowel sounds. Yeah. Right, I'm gonna go by light palpation. Light palpation, I'll be going by zigzag, and then the upper right, and the lower left. I'm gonna go like that. So, did you feel any pain or tenderness? No pain or tenderness felt. Abdomen wall is soft to touch, and temperature is warm to touch. There's no guarding or ridging noted, or any abnormalities noted. That's it. Thank you. Thank you so much.